I want you to have a firm understanding of the basics of what I mean when I talk about the unconscious. So, you probably have a general sense of what it is, but think about your mind like a refrigerator. More important, think about the unconscious mind like a refrigerator. So, you've experienced all of these different things in your life. From the moment you were born up until now, you've had thoughts, you've had experiences, interactions, attachments, hardship, all of these things. Where do they go? They go into the unconscious. We don't always readily have information available in the conscious mind. So, as you go about life, you accumulate experiences, some of which are positive, some of which are negative, and some are neutral. So what ends up happening with majority of us when we experience a very negative situation, we tend to put that in a container. So again, think about the fridge. We have a container now that's full of leftover food. So this is maybe a bad experience. This might be a trauma, a life-threatening experience, or an emotional trauma, what I call a psychic trauma, in which case we're putting it into that container, we're putting it into the fridge, into the unconscious, so then this way it doesn't affect our ability to function. Because if that pain isn't in our conscious mind, if we're not always aware of it and always interacting with it, that can significantly decrease our level of functionality. So what we need to do, we need to increase our functionality or at least maintain status quo. So we put that container like leftovers in the fridge and we forget about it. And we do this time and time again. So every single time that you've had a stressful situation, all the way up to experiencing maybe an emotional breakdown, you've put all of these containers, all of this leftover food in the unconscious fridge. The problem here is that over time, that food rots, very similar to what's going on in the unconscious mind. These experiences rot and they leak into the conscious mind. This is where we get intrusive thoughts. This is where we get nightmares. This is where we get flashbacks when individuals suffer from PTSD, post-traumatic stress disorder. So what needs to happen, at least what I do with patients and what my team does with patients at the Mind People, is we help you clean out your fridge. We dive into each container, some of which it's easy to process and clean out. Others, it's very difficult. It's very moldy. It's very toxic in there. So it takes some time to clean out. But over time, we go through each container. This is why therapy is longer term for the psychoanalytic approach.